Hi, guys.
Hi, Patreon.
Okay, sorry, guys. I'm on call.
She's on call, so we're doing the best we can.
Okay, sorry. Yes.
All good.
All good. All right, so
Welcome
what are we talking
back. We are talking about brain controlling toxoplasmosis.
Yeah. Sorry, I'm like thinking of like when we talk about like bacteria or viruses or
Yeah.
parasites, when we study these things, like I have visuals
Yeah.
of toxoplasmosis.
Yeah.
Yeah, I do. I have visuals. Okay.
Here
But yeah, let's
we
talk
are.
about it.
Let's talk about it. I think this one was voted in as well through threads or somewhere. Anyway, so here we are talking about it. It's pretty interesting. It's exactly what it sounds like.
Yeah.
Yeah. So what is it, Doc?
All right, so toxoplasmosis or Toxoplasma gondii, okay, is a common parasite that can infect a wide range of warm-blooded animals, including us humans, okay? So the parasite forms chronic and non-immunogenic brain. Oh God, girl, you had to bring in the freaking life cycle.
I mean, it's part of it.
Okay, so the parasite forms chronic and non-immunogenic cysts, okay, which typically form in the brain and muscle cells of the infected mammals, including humans. So in rodents, all right, toxoplasma infection has been shown to alter behavior, such as reducing the innate fear of predators like cats, which is beneficial for the parasite's life cycle as it needs to be ingested by cats to reproduce sexually.
This is where the brain controlling starts.
Yes. So the mechanism behind this behavioral manipulation is not fully understood, but may involve the parasite secreting molecules that alter the brain function, the formation of the brain cysts that interfere with dopamine production, or the inflammation triggered by the actual infection. In humans, latent toxoplasma, so kind of the later half of toxoplasma infections, have been associated with increased risk-taking behavior, entrepreneurship, psychiatric disorders like schizophrenia and intermittent explosive disorder. However, it's important to note that direct causal link between toxoplasma infection and specific changes in human behavior hasn't really been definitively proven, and there's still like research behind it. What?
Oh no. I'm remembering this like long time ago. I'm talking a long time ago, like maybe 20 years ago. I saw like I think it was like Discovery Health or whatever when it was still around.
Yeah.
And it was about about like how there's a parasite that a lot of people have and they don't even know that they have it. Very common, all the things. And then it could affect you in ways of like back then they had already seen that people with that infection had higher rates of car accidents and all these things. It's like crazy.
Yeah. I mean, again, it's affecting your brain.
Yeah.
So
And you don't even know that you have
you don't
it.
even know you have it. Exactly. So the effects on human behavior are thought to be like a hangover, quote unquote, but the parasite's adaptations to manipulate rodent brains, even though there's maybe no direct benefit to the parasite, is altering human behavior. So while toxoplasma infection is very common in humans with up to 80% in some populations, most infected people show no overt health issues or noticeable symptoms. However, it can be transmissible. Okay, so just because you're not like having symptoms of the infection doesn't mean that you're not infected. Okay. So in summary, Toxoplasma gondii parasite has a remarkable ability to influence the behavior of its host, particularly by reducing the fear responses of rodents, which benefits the parasite's transmission, while the mechanism behind its effects on humans' behavior are still being investigated. The evidence suggests that this common parasite may have subtle but significant impacts on the minds of humans as hosts as well. So it does have other stuff, like other things that happen that occur in the brain, so that we can see, altered personality stuff.
Right.
Like if it's infecting your brain and you're having changes in your brain because of this infection, you're gonna have symptoms, you know. So it's like someone having a toxoplasma infection of the eye. You're gonna start having visual problems, which can happen.
I hate things of the eye.
Yeah.
The eye is like, Mario just recently found that out about me. He's like, you listen to all this stuff, you watch all this like crazy gory stuff, you have no problem. The eye, well, when this happened, I like got lightheaded and everything.
Oh my God.
There's something about the eye that just like, it's like my weakness, like the eye. I could watch.
I don't really like the eye either, though.
Oh, I don't know. There's something off about it. Anyway.
All right.
So symptoms of toxoplasmosis. Plasmosis.
Toxoplasmosis. Yeah.
Toxoplasmosis. Some people, I mean, honestly, most people infected with it do not show any symptoms and are totally unaware of the infection. In those with weakened immune systems, such as individuals with HIV and or AIDS, or those receiving immunosuppressive therapies, toxoplasmosis can cause severe health issues, including encephalitis and other serious diseases. Pregnant women are also at risk, as the infection can be transmitted to the fetus, potentially causing miscarriage or birth defects. I remember when I got pregnant with MR, that was like the first thing in my mind was toxoplasmosis.
Oh my God.
I'm a nerd like that. Like I was just like, I need to check if I have a toxoplasmosis. I'm telling you, that show and Discovery Health scarred me when I was like 15 or some bullshit when I
Well,
saw
I
it.
mean, toxoplasmosis, CMV, all those what we call torch infections.
Yeah.
We do want to make sure you don't have.
Yeah.
It. Okay.
It was like, but so random. I was just
Yeah.
like, I don't even
Random.
have cats.
Yeah,
You
I
know,
know.
which we're gonna talk about now, why cats. But anyway, I'm like, I don't even have cats, and I'm like obsessed. I did not stop bothering Mario. I'm like, I need to check if I have toxoplasmosis. He's like, you don't have it. I'm like, how do you know?
How do you know?
How do you know? Anyway. So yeah. So in summary, brain controlling toxoplasmosis is a term that encapsulates the intriguing and somewhat mysterious ability of Toxoplasmosa gondii to influence the behavior of its hosts, including potentially humans, by infecting the brain and central nervous system. Fucking see, this is my if you guys, well, you're Patreon, so this will go back to the prions disease. This is my familial
God, no. Prions are so much worse.
yeah, but like you don't even know you have this stupid thing, and
You know, you do prions for like 30 years.
no, I know, but still.
She crosses her hands. I know. All right. So what's the life cycle of Toxoplasma gondii? God, I hate this.
We're gonna keep it very basic for you. I tried to keep it very basic because this gets.
I just have the little image of like the arrows.
I
and
have
the
this
humans
image
and the road.
with your brother. 'Cause
Really?
I
Oh,
yeah,
because
I
you
took
took parasitology. Yeah.
with him. Oh my god, the best, probably the best freaking class I took in my undergrad because it was it. If you know, you guys obviously don't know him, but like it's her younger brother. He's also a doctor. He is her. Like
Male form.
He even looks like her. Like it's crazy. Like when I first saw him, I'm like, of course you're her brother. Of course you are. And I'm telling you, I was taking a class with Yvette, like the male version of Yvette, that that whole semester. It was amazing. I loved it. I think that's why I like parasitology as much as I do too.
because
of Victor.
He's great. He's a great guy.
All the times that we would go through these cycles, and he was just looking at me like, awesome,
That sounds like him.
amazing.
All
Anyway.
right. So let's talk about having a definitive host. Okay. So the parasite needs to live somewhere. Okay. It needs a host, right? So the definitive host for Toxoplasma gondii is the cat. All right. So where the sexual reproduction of the parasite takes place.
Were you not worried? You have cats. You've always had cats.
Yeah, but Toxoplasma is really for like cats that are like outdoor cats. Usually they're kittens as well. It's not like adult cats either. But usually like indoor cats that really don't go outside, the risk is really low. However, when I was pregnant, I did not change the litter box.
Oh yeah, I wouldn't. I wouldn't either.
Yeah, then the partner at the time doing that. Okay.
Like,
Yeah. Change that cat litter box. All right. Anyways, so the cats are the only hosts in which the parasite can reproduce sexually, and then they shed the oocytes, right? So those little eggs in their feces. Okay. So the intermediate host, okay, so you have a like where they sexually reproduce, and then an intermediate host kind of just like holds them off, okay, but they cannot reproduce there. Okay, so the intermediate host includes a wide range of warm-blooded animals, so this could be humans as well. These hosts become infected by ingesting the sporulated oocytes, okay, or tissue cysts from the environment. I'm not going to pronounce that word. The environment, or by consuming meat infected with the tissue cysts. Yummy. More reason to be a vegetarian.
oh boy, yeah, it's a day.
Yeah. So the oocysts, all right? So we're going through a little life cycle. So the oocysts, the environment, the oocysts take about 2 to 3 hours, sorry. Wait, no. not
Wait, what?
2 to 3 days,
Yes.
48 to 72 hours.
Oh, damn.
Everyone be infected with
Exactly.
to sporulate and then become infective. Okay, so mature oocysts measure 10 to 12 micrometers, right? Micro.
Yeah, and they contain like two of them. That's why they're like a little
Yeah.
bit bigger. It's like
And then the diameter is basically contains two of the little spirocysts. Yeah, disgusting.
Yeah.
So, oh God, tachozoites. Okay, God, Julie just is throwing in the life cycle and all these complicated
sorry, but
names,
it's literally like
biology names.
but it's important. It's in the how we get it.
So
and
after
that shit.
ingestion by an intermediate host, the oocysts transform into tachozoites, which localize in neural and muscular tissue and then develop into tissue cysts, bradyzoites. Okay. Tissue cysts, bradyzoites, these cysts can remain throughout the life of the host and are commonly found in skeletal muscle, myocardium, brain, and eyes.
The myocardium, by the way, is
The heart muscle. So reinfection. Cats can become infected by ingesting intermediate hosts harboring tissue cysts by consuming the sporulated oocyst directly. So if they can reproduce in cats and then they can also infect the cat as well. Yum.
Cats. I mean, I love cats too, but I'm like, with knowing Toxo, I'm just like, I don't know.
I love cats. All right. So the life cycle of Toxoplasma gondii is complex and involves both sexual and asexual reproduction, which we're not going to need to go into. But humans can become infected by ingesting the sporulated oocysts, consuming meats that are infected with the tissue cysts, or through other routes such as blood transfusions or organ transplantation or like vertical transmission. So I'm giving it to a baby.
Yeah.
So in humans, the parasites form tissue cysts, which may remain throughout the life of the host and can be diagnosed through serology. So basically blood tests and stuff, or molecular methods such as like PCR, which
Lab
those are
tests.
just lab tests. Yeah.
Yeah. So what are the risk factors for toxoplasmosis and how is it transmitted to humans? Because, we've been talking about cats. So the risk factors for this infection are eating undercooked meat, especially pork, lamb, and venison. God
Venison
damn
is
it,
having
venison.
a moment today.
I know. Anyway, so consuming raw or undercooked shellfish, such as oysters, clams, or mussels, everything that I like. Accidental ingestion. Maybe I have a prion disease or toxo.
Stop.
Talk. Accidental ingestion of the
Called 10 o'clock in the morning or 11. It's 11.
It's already 11, but anyway, it's so this is the third episode we're doing today already at this point. Yeah. Let's go on. Accidental ingestion of the parasite through contact with cat feces. Hence why she was like, you clean that, which can occur by cleaning a cat's litter box, touching or ingesting anything that has come into contact with cat feces, or accidentally ingesting contaminated soil. Mother to child, congenital transmission, which can occur during pregnancy, receiving an infected organ transplant or infected blood via transfusion, though this is rare.
Yeah,
so
I mean, we test for these things before. So.
Exactly. Yeah, you would hope, but anyway, so in addition to these risk factors, a case control study in the US identified that the following factors associated with toxoplasmosis. So eating raw ground beef, eating rare lamb, eating locally produced, cured, dried, or smoked meat, working with meat, drinking unpasteurized goat's milk, or having 3 or more kittens. So a separate model among persons asked about eating raw oysters, clams, or mussels also found this to be a significant risk factor. In pregnant women living in rural areas and eating raw meat have been identified as independent risk factors for toxoplasmosis. So I'm clearly in danger.
All right. So what are the preventable risk factors for toxoplasma during pregnancy? Okay. So the symptoms of severe toxoplasmosis include, this is severe toxoplasmosis. So blurred vision, all right, confusion, loss of coordination, fever, muscle aches and pain, sore throat, headaches, swollen lymph nodes, eye pain, poor vision, floaters, just guys, literally the list goes on, like seizures, hearing problems, a rash, so so like
That's why it's so hard to like even know if you have it because it's
more rash,
it's swollen everything.
anemia, low platelet count. That's actually a common one. Seizures, right? Because all the stuff that's going on in the brain. Low birth weight is another one. And then cerebral calcification. So this is a big one. Okay. This is like one of those keywords that we
Hallmark,
use,
like
hallmark stuff. So cerebral calcifications. So basically you have calcification. So just calcium buildup around, usually these are periventricular. So they're along the lines of the ventricles. Okay. And those are typically associated with toxo. That sucks. Yeah.
Yeah. The key differences between mild and severe. So mild or asymptomatic mild or asymptomatic toxoplasmosis. Most people infected do not have any symptoms. In healthy individuals, the initial infection may cause flu-like symptoms such as fever, swollen lymph nodes, muscle aches, and skin rash that last for weeks to months and then they just go away. The parasite then remains dormant in the body, often without causing further issues. That is what I hate about these freaking like parasites. Sometimes they just stay in
live
there.
there.
They just stay in there, like feeding off of you, and you don't even freaking know. Anyway, then difference with from there to severe. Severe is more likely to occur in people with weakened immune systems, HIV/AIDS, cancer, or who have received organ transplants. Symptoms can include confusion, poor coordination, muscle weakness, seizure, changes in alertness because of this encephalitis and inflammation of the brain, breathing problems, fever, and cough due to lung infection. So now we have Brownie here. Anyway, so like I said, breathing problems, fever, and cough due to lung infection from this, eye pain, poor vision, and floaters due to ocular toxoplasmosis, because you could also have that with this. In congenital toxoplasmosis, so again, from mother to fetus, symptoms at birth or early in infancy can include blindness, mental disability, and seizures, which is why I was like horrified and super scared of this when I was pregnant. Untreated severe toxoplasmosis can lead to organ damage and death, especially in immunocompromised individuals. So very, very different from mild to severe. Like in mild, you pretty much either you don't feel anything at all or you have like flu-like symptoms, and then severe, it's like life-threatening.
Yeah.
So yeah.
So long-term effects of toxo. He just has one paw on my thigh.
I see that.
Yeah.
See
So
that.
the long-term effects of toxoplasmosis can vary depending on the individual's immune status and also when the infection was acquired. So here are some potential long-term effects. So immunocompetent individuals. So these are people that have an immune system, okay? Or not a weakened immune system. So most healthy people become infected with toxo and don't have any symptoms because their immune system basically kind of just keeps the parasite from causing any illness. Okay.
Keeps it at bay, like
And then when the illness does occur, it's probably just like mild flu-like symptoms. And then maybe you might have some tender lymph nodes, maybe a little bit of body aches, flu-like symptoms.
Yeah.
Okay. However, the parasite does remain in the person's body in an inactive state and can become reactivated when the person becomes immunosuppressed. So kind of what we see with shingles.
Yeah, exactly.
Okay?
Herpes.
Yeah. So there is evidence suggesting that latent toxoplasmosis may be associated with various psychiatric disorders such as schizophrenia, bipolar disorders, and changes in behavior and personality. Okay. So kind of very similar to HSV. HSV can cause infections in the brain, and then people can have presenting signs of acute psychosis.
HSV is herpes.
Herpes, yeah. So in immunocompromised individuals, individuals with weakened immune systems, such as babies, older people, people with HIV/AIDS, people that have chemotherapy, are at risk for severe manifestations of toxoplasmosis. So reactivation of chronic infection can lead to severe symptoms, including neurological signs and confusion, poor coordination, muscle weakness, seizures, and also changes in how alert you are. Ocular toxoplasmosis, I've had a case of this before. I actually had two
Really?
cases. Yeah. And can occur and then leading to reduced vision, blurred vision, eye pain, redness of the eye, and sometimes tearing. But, if you're not treating it, you can actually lose your vision there. All right. And then congenital toxoplasmosis. So small field. Okay. So infants infected before birth can show symptoms at birth, but can develop similar symptoms later in life. So this can include vision problems, mental disabilities, seizures. A small percentage of infected newborns have serious eye or brain damage at birth. And long-term sequelae of children with congenital toxoplasmosis may include hydrocephalus, seizures, cognitive, hearing, and visual impairments.
What's sequelae again?
It's like the after effects of an infection.
Okay.
Okay, so like, permanent complications that you can have from that.
Okay.
So ocular disease, you can have eye lesions from congenital infections, but that typically occurs 20 to 80% of congenitally infected persons by adulthood. Okay. So it's kind of low, like slow. Eye infections lead to an acute inflammatory lesion of the retina, which involves leading a retinochoroidal scarring. And then the eye disease can reactivate months to years later, each time causing more damage to the retina and potentially leading to progressive blindness or vision loss. The psychiatric and behavioral disorders, Toxoplasma infections has been associated with the presence of psychiatric disorders, including schizophrenia, bipolar disorder, suicide, self-harm, memory impairment in older age. The hypothesis that the parasite may increase the dopaminergic signaling in the brain, which is those neurotransmitters that we've talked about in other episodes in the brain, which could influence the behavior and mental health. So more research is needed to see like what are these, how does toxo cause these psychiatric issues. And then risk of accidents. So chronic toxoplasmosis has been linked to an increased risk of traffic or worksite accidents, possibly due to the impaired reaction times and subtle behavior and alterations that make, this is like so interesting to me.
Isn't
I'm like,
it?
just toxo? I'm like, have you had studies in other things?
I know, but the fact that they were able to like
Link those two together.
yeah,
Yeah.
I was just like, damn.
Yeah.
That's why I hate this thing.
Yeah. So it's important to note that even though while these long-term effects are possible, they're not guaranteed. Every individual, okay? So the majority of infected individuals may stay asymptomatic or experience only mild symptoms. However, the potential these long-term, lifelong effects underscores the importance of prevention, especially with pregnant women and immunocompromised individuals.
I just hate how sneaky it is. That it's like, oh, mild, or you have a cold, or, or nothing.
That's a parasite.
Nothing. And then all of a sudden, it could just wreck you up.
Yep.
Years later. See what I mean?
Yeah.
Ugh. I hate that. I hate that. How like so fucking sneaky. Ugh.
Yeah.
Anyway, so how's it diagnosed? So it's diagnosed through various lab methods, including serological tests, molecular testing, such as PCRs, histological examination, so it's like actually from the tissue, and isolation of the organism. A little bit of a detailed look. Serological testing, it's a method for diagnosing toxoplasmosis, and it's detecting the antibodies of it in the blood, which are produced in response to toxoplasmosis infection.
Yeah. So you have an infection, your body creates antibodies against it.
To try to fight it.
Exactly. And then you have the antibodies in like the first infection, those first like 1 to 2 weeks. And then you have the antibodies, like your memory antibodies. So that if you were to ever get infected again, your body can pull out those memory antibodies.
And that's what these labs are looking for. Yeah. So then literally everything that she said in a much better way. So we'll stick with that. So molecular testing, which is PCR, it's used to detect toxoplasmosis DNA in the blood, amniotic fluid, CSF, so cerebral spinal fluid, ocular fluid, or tissue samples. It's particularly useful for diagnosing congenital infections in utero and in immunocompromised patients where serological tests may be unreliable. So it's PCR testing on peripheral blood has been used successfully to detect cases of ocular toxoplasmosis as well as invasive toxoplasmosis. Histological testing, direct observation of the parasite in stained tissues, and CSF or other biopsy material that can be used for diagnosis. Okay, so this is what we saw plenty of in that class. They're gross. Parasites can be isolated from the blood or other bodily fluids by intraperitoneal inoculation into mice or tissue culture, although this process can be time consuming and is used less frequently, obviously. Imaging. So techniques such as MRI, CT scans can be used to detect irregular structures in the brain related to toxoplasmosis, especially if there are symptoms of brain inflammation. And I can imagine that calcification also, you could see it through this.
Oh, yeah.
So ocular examination, obviously. Eye disease caused by toxoplasmosis is diagnosed primarily by ocular examination, which may include the use of special lenses or cameras to see tissues inside the eye. So it's important to note that a negative PCR result does not rule out an active infection, as the sensitivity of the test can be affected by the specimen type and the volume of the blood used for DNA extraction. Additionally, serological tests can sometimes be unreliable, especially in immunosuppressed patients. And I can never say this word. I don't know why I keep writing it. Confirmatory. Yeah. Testing through reference laboratory is advised. So that's the other thing, that not every lab could do these tests.
No, a lot of the toxoplasma labs that I've ordered in the past, they're send-outs.
Exactly. They have to go to specific labs that have
And we do have like PCRs, like some not major, like bigger hospitals will have the PCR test or the antibody test. I'm sorry, the antibody test, but
yeah,
like most of the deeper toxo labs we do have to send out.
Yeah.
It's like Palo Alto, Texas or something. Texas, right?
Yeah.
Yeah, Palo Alto.
The choice of diagnostic method may depend on the clinical presentation, the patient's immune status, and the availability of the testing facilities, as we were just saying. So, for example, pregnant women's serological testing is important to determine if an infection is current or past, and PCR testing of amniotic fluid may be performed to diagnose fetal infection. In immunocompromised patients, such as those with HIV/AIDS, PCR testing may be used to confirm or support the results of serologic testing.
So what is the treatment for toxoplasma? It's a lot of antibiotics. Okay. Sorry if I spoiler alert. So the treatment for toxoplasmosis typically involves a combination of antiparasitic medicines and antibiotics, which are used to stop the active parasites. Okay. So the specific medications commonly used is pyrimethamine, okay, which is considered the most
It's just the parasites are just gross, man. Like, they're fascinating but gross.
Disgusting.
Like, the thing, there's so many TikToks about it, of like people taking these. That's why every time I see these drugs, like the antiparasitics, they're like, I took this antiparasitic and I'm just shitty worms. I'm like,
that is such BS. That is such BS. It is such BS.
It's everywhere on TikTok, though.
I know, but people
it's
lie
like ridiculous.
everywhere on
Yeah,
I literally saw a TikTok of a girl saying that she took, like, it's on Amazon. It's like some anti-parasite, like,
you see what I mean?
And she's like, I went to Target and I pooped my life away. And she's like, I looked at the toilet and I could see all the worms.
You see what I mean?
And I'm like,
that's where what I see all the time at freaking TikTok.
I'm like, yeah. I'm like, you were ridden with worms and you didn't have any symptoms.
Yeah, that's the thing.
You just shat away your whole entire colony of worms. You didn't have bloating.
Yeah,
or abdominal pain.
Yeah.
Or a diminished appetite. Or anemia.
Yeah.
Or any of that. But you just shat away with one Amazon purchase. Like, do people think that we're stupid? You know, like, and yes, like, I know. I mean, not that you believe it, but you know, like,
become
people
a trend.
and you're like, oh, you know, but like, yeah, but even if it's a trend, I understand if it makes people think more of like, you know, and like actually go and do like real research onto things, you know, and like common sense. But because it's TikTok and because these people are literally grabbing their phone, it's like, guys, I literally just shat my life away in Target. And I know it sounds gross, but I need to share this with you. And I'm like, no, actually, you don't.
You don't. Please don't.
You don't need to share this with me. I don't need to know that I don't know what you saw in your shit, so maybe you should see a doctor. But I can tell you that it wasn't the fucking parasites, okay?
I love how triggered you got of this.
But that's how they do it. They're like,
I did not know this was going to be this.
No one's going to be convincing if you're like, hey guys, so I went to the bathroom and I noticed something kind of weird, so maybe it is. No. These people, they want to convince a person, right?
Yeah.
So they're like, listen, guys, I'm not gatekeeping anymore because I want everyone else to shit out their fucking worms. And I'm over here like, oh yeah, Sure, because you took like an herbal medicine from Amazon.
Oh my God.
So all of a sudden you just shit out your whole colony. Like that whole colony that was in your small and large intestine, in your stomach, in everything, you shot all of it out in Target. Okay? The at Target. Like seriously?
I'm obsessed with how triggered you got at this. I really didn't think.
I just hate TikTok trends.
I really said this not thinking at all that you were gonna
No,
get
the
so
next one
triggered.
is the boric acid trend.
What is
too.
that? No,
People
I know.
taking boric acid.
I know that they're taking it for what?
To just cleanse their system.
It's a fucking poison.
Yeah, but they're taking it to cleanse their system, and it's a
You-
trend.
it's
And
a-
people are just like that. They're like,
Use it for laundry.
I'm on day 3 of my boric acid trend. And I'm like, yeah, you're on day 3 of almost on your deathbed, probably.
Your poor liver.
Yeah.
The liver's probably like, what?
But
the
it's okay.
fuck
She
is
shot
this?
away her colony of parasites. So. I didn't know you had such a robust body that you were ridden with worms, not even eggs, okay? Worms.
Yeah, that too. Yeah, that too. I mean,
Worms.
and people don't like, guys. Do you know that like, okay, yes, you could have that, but they go to this extreme. And mind you, there's people out there with itchy assholes, and it's ascaris.
Yeah.
and nobody talks about
Yeah,
it.
exactly.
And it's fine. You go to Walgreens, you take some pills,
You take
and
a pinworm medication, Reese's, highly recommend.
sorry, and it's gone.
Yeah.
But nobody talks about that one because it's just an itchy asshole, and you don't see worms coming out of it. And then all of a sudden, it's just I agree. And then you have the people saying that they shit with worms out. I'm like, no.
Yeah, and that's the thing. Like they literally say that they like see it, like
Yeah.
that it's just like the way that like the person describes it. It's like if their whole entire toilet was like infested, you know. And why? Because they want the TikTok views,
Yeah, no, for sure. It's not. Look,
and they probably make some sort of commission.
Oh, for sure,
You know.
for sure.
So they're like, I'm gonna tell everyone what came out of my butthole, which is probably a lie.
I mean, I've seen.
I can't answer this. We almost got bitch slapped again. Our ring light is just
Just trying to get you. Trying to get you.
Julie's great though. Julie's like, wow.
Jesus Christ. But like, okay, I've seen maybe they're getting it from dogs. Because have you ever seen
Yeah,
like
you can get it from dogs. I'm not saying that parasites are not in
No,
are not
I'm
common.
saying that creator was probably like, oh, my shit's gonna look like the infected dog shit. You know? Have you seen infected dog shit?
No, I've seen dogs.
It's for real.
and It's for real. You
That's
can see
for real.
worms.
Like you
Yeah.
do see the worms
And
there.
they're moving.
Yeah. Oh, yeah. This one, when we first got him, he was ridden in that for sure.
Yeah.
Like all his poops were that. And I had to like, dude, the way that you know me. So imagine me with an infected.
I don't want to know. I don't want to know. I don't want to know.
I had to like, I was like with bleach, and then I was just like picking up all his shits and like dumping them. I would bleach it first, then pick it up with what do you call this, plastic bags?
Yeah.
No, then bleach again, the
Yeah.
place that, you know, where the shit touched, and then throw it away. It was awful until I finally got rid of that. He is parasite free for a very, very long time. He's actually turning 1 like now.
Yeah.
Totally fine. It lasted like for a couple of weeks.
Yeah.
Bro, my life. I was just like, and then no, it sucked. It sucked. So maybe these creators are like, oh yeah, we're like dogs. No, we're not like dogs in that aspect. This is not like dogs, but anyway, yeah, massive tangent. But yeah, these are the drugs that these
Okay, yeah.
creators
So
are.
pyrimethamine.
Yeah.
All right, so back to
Talking
our
about-
drugs. Pyrimethamine, which is considered the most effective drug against toxo and the standard therapy. Okay, sulfadiazine, which is often used as well with pyrimethamine, and then folinic acid, also called leucovorin, which is given to protect the bone marrow from toxic effects of pyrimethamine.
And that's the thing, like these people are just taking these, like if it's super benign or whatever, these drugs will make you feel like crap.
Yeah.
You know, they're not benign.
No,
It's-
and they're not like a 5-day course either.
no. So it's like, guys, don't be taking things you don't need to
Yeah.
take. Like,
So for the ocular toxoplasma, the treatment can also vary just, you know, depending on the size of the infection, the location, the characteristics.
many things.
But typically you need to see your ophtho for that. Okay, immunocompromised patients, such as those with HIV/AIDS or those who have undergone organ transplants, The treatment is particularly important and may need to be continued indefinitely. Why? Because they're immunocompromised and they can have a more severe disease from these
And
infections.
these fuckers could hide forever, and
Yeah.
so it's like, ugh.
Yeah. And also, people that don't have an immune system, so patients with AIDS, they have to be on these medications forever. Like, so prophylaxis. Okay. Just because of how predisposed you are to these infections.
Ugh.
Pregnant women, newborns, and infants can also be treated, although the parasite isn't eliminated completely. So the parasites can remain within the tissue cells and in the less active phase, making it really difficult for the medicine to actually work. And then most healthy people recover from toxoplasmosis without treatment, as symptoms are mild and usually disappear within a few weeks. However, for those who are ill, especially pregnant women and people who are compromised, have compromised immune systems, medications are usually prescribed. Okay. So it just depends on your risk.
Yeah.
Okay.
Yeah.
It's important to note that while medication can treat active infections, it doesn't destroy the cysts left by toxo. So if the immune system is healthy, the cyst should not reactivate, right? Because you have an immunity against it. But if the immune system is weakened, or in the case of congenital toxo, the parasite can be reactivated and then cause illness in the future.
And that's the thing about these parasites. Like, they have cysts that, like, you could put it on a torch and this fucker won't die.
Yep.
Like, I saw that in parasitology. They are so resistant.
Yeah.
Like these freaking cysts or oocytes or whatever, depending on the freaking whatever. But oh my God. And that freaks me out. And they could be just out on the sun, like all the things against them. And no, it's fine. They get ingested, you're infected. It's like, what? Anyway, so how long does it take to recover from toxoplasmosis if you get it? So the recovery time can vary depending on the individual's health status and whether the infection is being actively treated. Most treatment plans for toxo may last between 2 to 6 weeks, but individuals may start to feel better in only a few days. It may take 3 weeks to 6 months for brain injuries caused by the parasite to fully resolve. For healthy individuals who are not pregnant and become infected, symptoms, if any, are usually mild and disappear after a few weeks without the need of treatment. In cases where treatment is necessary, such as pregnant women, weakened immune systems, all those things, or with severe symptoms, the duration and the treatment can be longer. Pregnant women diagnosed with toxo may have to take medication for the rest of the pregnancy, and treatment for congenital toxo can last up to a year. So treatment with those with weakened immune systems can be given indefinitely, like she had said, to manage the infection. Therefore, while the initial recovery from symptoms might begin within a few days to weeks of starting treatment, the complete resolution of symptoms, especially in severe cases for those involving brain injuries, can take up to 6 months. Additionally, ongoing management may be necessary for certain individuals, such as those with compromised immune systems or congenital infections. So there's I'm going to briefly state the many ways that you could prevent becoming infected. And so be careful with food preparation and consumption. So cook your meat thoroughly, especially whole cuts of meat. So make sure they're full. And that's hard because for instance, I like medium, but it does come from that sometimes. Freeze meat for several days at sub-zero temperatures. Wash fruits and veggies. Avoid eating raw or undercooked meat, like I said, pork, lamb, venison, or shellfish like oysters, clams, mussels. Avoid drinking unpasteurized goat milk, particularly goat milk. And then hygiene and environmental precautions, so wash your hands. Definitely after touching anything with cats, especially cat litter. Wear gloves when gardening because it does live in the soil. Keep outdoor sandboxes covered to prevent cats from using them. That's kitty litter. Clean and disinfect all your kitchen surfaces and everything that you use in the kitchen when you're working with raw or undercooked meats. Cat and pet management. Avoid changing the litter box like she had said, especially when you're pregnant, or use disposable gloves if you don't have somebody to help you out with that. Wash your hands thoroughly afterwards and change the litter box daily. Keep cats indoors, just like she had said, to prevent them from hunting freaking rats or whatever the hell, or just
whatever.
Anything. They're little serial killers. So yeah, anything. And then becoming infected. Feed cats only canned or dried commercial food or well-cooked table food, not raw or undercooked meats. Avoid adopting or handling stray cats, especially kittens. And then don't get a new cat while you're pregnant or immunocompromised.
Yeah.
Water safety, avoid drinking untreated water. And yeah, these will significantly help prevent from you getting toxoplasmosis, which obviously is horrible and disgusting, and a lot of other adjectives for
So
it.
if you had any anxiety, I hope this kind of helped
Yeah.
or worsened it.
Yeah, absolutely. And I hope you guys liked this one. It was very interesting, if anything, and it's just crazy how it's brain controlling. You know, it's just crazy. But anyway, I hope you guys liked it. Keep following us. Keep doing everything you're doing. Thank you so much, patrons. You guys are the absolute best.
Thank you. Thank you.
And we'll see you on the next one.
Bye.